You mentioned that you were involved when you were in Oklahoma City for testing, and I believe you shared with me that you were tested for two different types of medication. Could you expand on that, please?
Absolutely. I did a trial for Kuvan, which is again through BioMarin Pharmaceutical. It is actually a tablet that is taken to essentially decrease phenylalanine levels within the blood. And ultimately, the patient, if a responder, is allowed to have a higher protein diet at that point. Um, and it's adjusted based on how many tablets you need. I know some individuals who responded to 15 tablets. I know an individual who has to take 30 a day. So it's a wide bracket. And I actually did not respond to Kuvan at all, which was initially kind of a punch in the gut. Um,
Mm-hmm.
and I've always been very fortunate to be receptive to the low protein lifestyle and dietary needs and the metabolic formula. Um, but there was something about Kuvan that I was a little hopeful for, and it didn't work, and that's okay. And then from there, I was asked to be part of, at the time, it was called PEG-PAL, which was an injection therapy to treat blood phenylalanine levels, and similar to Kuvan, to lower them with the hope that a patient would be able to increase their protein, increase their phenylalanine. I was very hesitant to participate in PEG-PAL because of the non-response to Kuvan, and the clinic in Oklahoma wanted wanted a female on the testing panel. So all of their initial participants in the medical trial for PEG-PAL were male. So I was the female guinea pig in Oklahoma. And it was shocking because Oklahoma City was one of the main trial sites, and I never would have bargained that. But I did end up taking on PEG-PAL trial, and that was a whole different animal than anything I've been accustomed to. We had a blinded study. I think if I had anxiety, it skyrocketed because I didn't know whether I was getting a placebo or what I really needed. And again, my sister finally said, I need you to take a breath because you're panicking over not knowing anything. So but it's scary when you're so regimented and then you don't know what you're receiving and what you're not. Within that trial, I had for a while weekly check-ins at the university hospital there at OU Children's, and weekly blood draws, weekly homework booklets that drove me crazy, but they were analyzing what I was eating and how I was responding with the injections. So it was necessary. Um, but ultimately, in the long run, I would say within about 6 months, I hit zero phenylalanine level, and I was a full responder to PEG-PAL. And by, I want to say, trial initially began at the end of 2013. And by 2015, actually, as I was boarding a plane to teach abroad in Italy, my dietitian called and said, so I need you to start eating 60 grams of protein a day. And when you grow up eating 5 grams of protein a day, 60 is a huge jump. So I went from that very regimented, low protein medical lifestyle to, oh, by the way, you need to be eating high protein and it needs to start now, because the flip side is if your level is too low, then you become sluggish and catabolic, and that's a whole other issue in and of itself. So but I was a full responder, still am, and that is my main treatment to this day. I take an injection every evening, and I actually have a free open-ended diet now, and it was removed from the medical formula in 2014.